Hello, everyone, and welcome. We're here today to have a panel discussion for the upcoming PDX Recovery Film Festival on September 18th, which is just coming up this week. Bridges to Change is hosting this exciting event for the first time this year. We put together a panel of experts to talk about the issues that this film festival is aimed at highlighting. So we're looking at highlighting homelessness, mental health issues, and addiction issues across the state of Oregon as we know them within our organizations. We have viewers from all over, but since we're based in Portland, today we have Tera Hurst joining us. She's the executive director over at the Health Justice Recovery Alliance, and we have the executive director over at NAMI, the National Alliance on Mental Health. Chris, can you say your last name again?
Sure, it's Bouneff.
Thank you. So we're super excited to have you two joining us today. I'm Monta Knudson. I'm the executive director over at Bridges to Change. So I just thought we could start off and learn a little bit about each of your organizations and what you're doing over there as your normal day-to-day work and how you're impacting our local communities. Tara, do you want to kick us off?
Sure. Thanks, Monta. So I'm Tera Hurst. I'm the executive director for the Health Justice Recovery Alliance. We are a new organization, new project that was spurred by the passage of Measure 110, which was the decriminalization of small possession of drugs and really investing significant amount of marijuana tax revenue into recovery services and harm reduction services. So housing, harm reduction, peer services, and low barrier treatment options. Which is a lot of what we're going to talk about today. We have over 75 members that really span from medical associations, labor unions, providers, and community of color organizations and serving organizations. So that's a little bit of what we do, and we're really focused on making sure that as this law gets implemented, it really is focusing on two things. One is that addiction and substance use is really a healthcare issue and not a criminal justice issue, and should be dealt with in the health space, and as should be centered on the communities most impacted by the war on drugs in Oregon.
Awesome. That's super exciting work. And I believe, if I'm correct, that is adding about over $100 million a year to services, addiction services around the state of Oregon. So that's a huge win for service providers as well.
Yeah.
Chris, do you want to tell us a little bit about NAMI?
Yeah, sure. So I'm the executive director of the Oregon chapter of the National Alliance on Mental Illness. And we have 15 chapters that across the state that do the bulk of our services. We're often known as a advocacy organization, and we do a lot at the legislative level and policy levels and working with large health systems. But what we really do at our heart is we're a grassroots organization that provides free education and support programming for basically kind of any member of a family structure for a family affected by mental illness and other behavioral health disorders. So whether you're a family member, your parent raising a child, you're an adult living with a significant mental health disorder, we have particular programming, free programming for you to learn about what is this all about? How do I keep myself well? How do I keep my family well? If I'm a parent or caregiver, how do I advocate for my child? And then I think, important to note for us is we're not a clinical organization. So we're really a peer-based organization. So if you take a program from ours, you are taking it with other people with shared lived experience being facilitated or taught by people who have that same lived experience. So we create all those safe spaces. And what I really like about our organization and why we do it this way is these are disorders that affect an entire family structure, whatever that family looks like. And in the treatment system, we're often really focused on the individual that has the issue going on. And we just don't equip the rest of that structure to really help. And that's when we end up with people at odds, and often families at odds, because they're trying to help their loved one and don't know how to do it. And then for people, again, living with these things, there are things in the treatment system you just don't learn how to do. Overall wellness, relapse prevention, relapse planning, just all these things that really aren't there in the treatment system is that information gap that we try to fill.
That's great. And you all put on a giant walk each year, is that correct?
That is not the last 2 years, but yeah, I mean, we're very proud, NAMI is a national organization. There's state organizations in all 50 states. There's multitudes of walks out there in very large states, but we're the largest single event on the West Coast. In when we can do these things in person, we attract upwards of 7,000 people out to the East Bank Esplanade for a walk. So it's a great visibility of behavioral health awareness, both for mental illness and substance use disorders.
That's great. That's great. Well, I've been at Bridges since 2015 as their new executive director. The founders that founded the organization in 2004 retired in 2014. And we kind of focus on three primary areas over at Bridges to Change. One, we're a peer run organization, which means the majority of our folks that work for us self-identify as a person with lived experience. That could be with addiction or mental health or both, previously houselessness challenges in their past. And so we focus on peer services, which are recovery mentors or peer mentors, to really walk alongside folks that have that have the need to kind of find a way out of their current situation that they might most identify with. We also do housing services across 4 counties in the state, primarily here in the Tri-County area, and we're also in the Dalles, which is in Wasco County. And we also provide outpatient treatment services, addiction and mental health within Multnomah, Clackamas, and Washington County. And so we really try to put together housing services, treatment services, and peer services, really with peer services at the core of everything that we do. And so, interesting enough, Bridges to Change has been around since 2004 and has never had an annual event. So we've been trying to have our first annual event for the last couple of years. Last year, we were going to host this. And of course, as we know, COVID had different things in store for us. This year, we are set to do it at a theater here in town, Revolution Hall. And because of the Delta variant, we decided to move to virtual. So we are doing it this year. So we're super excited that this is our first event. It's hosted, the PDX Film Festival is going to be our annual event hosted by Bridges to Change. And we're going to be showcasing films about addiction, homelessness, and mental health. So viewers can take a real look at what's impacting our communities and generate hope through storytelling and connection. And so that's our hope. And this is our first annual event. So thank you too for joining me for this little panel discussion so we can kind of get people thinking about how our folks are impacted and what we're doing as different advocates and service providers in the community. And so I have a few questions here that I want to discuss and get each of our kind of opinions on and what we're doing. Maybe just think about some of the questions. We all know that homelessness is a deeply traumatic and dehumanizing experience that really no person should have to experience. And we see it all around the city of Portland and the Tri-County area. We see folks that are just struggling. We see the encampments, and we know that there's so many different stories within each person and why they're there. And I think folks that were houseless 5 years ago look totally different than they do today. There's so many different stories and reasons people are there. And so the first question is, how do we see the housing crisis show up in the work that we're currently doing? And do you all see any solutions right now that are gaining any traction, or any other comments around how the housing crisis is showing up in your each individual work? Tera, you want to start us off?
Sure. So the housing crisis, I think, is hard to not show up in any of our work. And it's definitely one of the key pieces of Measure 110. And one of the things that makes me really excited about Measure 110 is it's not just about traditional treatment beds, but it's really about making sure that we're meeting folks where they're at and meeting those needs. And a lot of times we send somebody through a 30-day program, but then they have no safe housing. They don't have anywhere to go, and it becomes increasingly harder to be able to use the tools that they learned in treatment. And so recognizing that housing is a core need and value that we have and that we need to invest in, and that it looks different for everybody. So, it could be abstinence-based, it could not be abstinence-based. It needs to be where the person is and what they need, and making sure that you include wraparound services, and that looks different for everybody. So I think it is about, even though it makes it feel a little more overwhelming, it's about recognizing that each person, as you said, Monta, has their own story and is there for a really unique reason and has unique solutions. And it's up to us as advocates and providers to make sure that we are creating access to those solutions. So for the Health Justice Recovery Alliance and our members, and especially the providers that sit at our table, most of them provide some type of housing, including Bridges, that just is sorely under-resourced, and feels like it's always at the threat of closing. And ultimately, if we're not investing in housing, we're not really investing in the solutions that are needed, and not just short-term housing, but really meeting people from transitional all the way to permanent housing. So that's the work that's how the housing crisis shows up, is that I think it's the first step in helping folks who reach out, is to make sure that they're somewhere safe, because you really can't work on yourself and utilize any tools until you're safe.
Yeah. And the other, since I've done a lot of work with you on Measure 110, and the other exciting piece that I see that shows up in that space is, as a housing provider, we're often kind of stuck in this referral pathway that is only allowing people into housing if they fit these requirements, right? And so you have to say no to a lot of people, like, oh, you can't come in because you're not coming in through this doorway because you don't fit this referral pathway. And the great thing about Measure 110 and the funds that are coming into play is that anybody can access services. Anybody can access the housing, the peer services, the case management support, all the great ideas that providers are coming up with to use this Measure 110 money for. And so I'm super excited that the housing portion of Measure 110 isn't going to put up a barrier because of a referral source, right? So that money's really going to open up a lot of pathways for folks. So I know as a provider, I'm super excited to not have to vet people through a referral process. Rather, if they show up and they want housing services along with others, if that's what they want, that we can provide that for them. So I know that I'm excited. I know other folks are excited as well. Mm-hmm. Chris, in your work over at NAMI, how do you see the housing crisis today show up within the advocacy work that you're doing here in Oregon and maybe also around the country?
Yeah, I think it's important to note that prior to the pandemic, we were not on a good trajectory anyway. So what the pandemic did is really put everything on warp speed. And the way, I thought it was Monte saying, what we see in houselessness 5 years ago is not the same. That's true for a cohort of people, but it's also really expanded the people you would have seen 5 years ago as well. So I think the challenge is it's building housing is hard. It takes a long time to do it. And we were behind the 8 ball to start with. And now, I don't know what the pool analogy is using an 8 ball, but it's as if, there's no pool balls on the table anymore. And you wonder, will we ever actually dig ourselves out of this? And because there's really a sense of urgency anywhere in the state, in any system, to recognize we are in a true crisis that may require some very speedy but imperfect responses. How it really plays out with people who live with serious mental illness is, one is you either don't get housing, you do get housing, but you're going to get kicked out of that because you have mental illness. And so you act oddly because, your landlord, understandably, if you act out, that's going to be disquieting to people, including landlords. Three is we just never had in the state has really developed the type of services that help people with serious mental illness stay in their housing. So the intensity, the frequency, the workforce that is well compensated and well trained. It was very marginal to begin with. Again, really, the pandemic just laid that really bare. And then what you're seeing is because things, the need is growing exponentially. There are people coming forward who under normal circumstances may have not come forward with this intensity of need. You come into these shortages and what you have are people parked either at levels of care where they shouldn't be because there's nowhere else to go. So I was working with one family, their loved one was in inpatient psychiatric care for in excess of 200 days because there wasn't a step down care. So, what's the decision there? A hospital discharges to the street, or do they hold on to that person, meaning someone stays in the emergency department or stays on the street because we don't have an inpatient bed left? So you have really this shortage, this trend we were on that we would have seen this level of crisis maybe 4 or 5 years from now happen now. And how it's playing out in our work is it's just the impacts are immeasurable. Is there, your second part of your question, are there solutions that you see gaining traction? No, because we're not treating this circumstance as the crisis it actually is, which means you have to do things that bridge you to long-term. So we're doing some things that may have an impact long-term, but we're not doing the things to get us to those solutions. So that means we have this large cohort of people who are going to be suffering needlessly. We are going to lose some of those people, either their life or to the criminal justice system, or to just being lost somewhere out there, forgotten by society. And to layer on the good news, because I feel like I'm the harbinger of doom here, we're not doing anything either to prevent people from reaching that state. So you have this pipeline of people that were just flooding, continuing to flood into this most acute level or highest level of acuity, highest need, most complex responses. We're not cutting down on that demand. And so by the time we get to some of these long-term investments that we'll talk about, whether it's ballot measure 110 or stuff that the legislature did, I put it this way. I mean, we're planning for fire suppression for wildfires, and we've got an uncontrolled wildfire going on, and we're not fighting that fire. So by the time we get there, it may be too much, too much going on too late with our responses. And I think that's really where we are as an organization are really, really concerned.
Yeah, all those are really good points, Chris. It got me thinking about how far we were behind on the issues that we're trying to address right now. And then when COVID hit, it really stopped everything as organizations tried to figure out how to manage COVID, how to manage services. And so it put us not even just a year and a half behind, but it really threw us way back behind. So it's going to be tough for us to come out of this. I'm curious, in your advocacy work, I know that there was a lot of legislative wins this last year. I'm kind of jumping ahead a little bit, but I think it goes back to what you were saying. What did you see at the legislature this year that you think was a good win for behavioral health on the mental health side?
Yeah, so I think it's a good win both on mental health side and substance use disorder side. So you had the legislature put in close to $400 million in new money to get us to kind of a newer system, a wider system, a more transformed system. So that was significant, and in that manner, it was really an unprecedented session. Yet those investments aren't really going to roll out until 2023, 2024, 2025. I think the other piece that nobody really has talked about, Oregon passed now the most comprehensive piece of insurance parity legislation in the nation. So new requirements around both commercial insurance and Medicaid managed care plans around how we look at substance use disorders and we look at mental health disorders, and not so much, trying to really make sure that people get to the treatments they need for the duration they actually need it. To get to wellness. And it's a new articulation of parity This is new based on a class action suit out of California. And there's just tons of activity across the nation about kind of this new articulation of parity. Oregon's one of the first states following California to adopt it. And right now we are the gold standard. But again, that's a little bit longer term impact. So changing how insurance treats utilization management so that if I have a substance use disorder, for example, I can get to residential care for the duration necessary. I can get the follow-up services once I'm discharged for the duration necessary, that we're treating the underlying condition and not just the crisis. And the same on the mental health side. And if this were 4 years ago or 8 years ago, I think we'd all be it's so ecstatic that in knowing that long-term we were going to make these dramatic changes for the better in Oregon. And yet the complexity is we haven't addressed the now. And unless we do these things concurrently, this bridge again to that future, the worry is we'll just be so far behind that these investments will pale in comparison to the need. When they, if we address the now, if we do some crisis kind of management, maybe we actually have the impact coming out of this fantastic session to make long-term change that really benefits people.
Mm-hmm.
Yeah. And with all that, I think this is good for the folks that are going to be watching this, because we often, we can talk about how to address homelessness or houselessness in our communities. What a lot of people aren't aware of is the systemic barriers that we're up against from a financial perspective, from organizations that are trying to fund and come up with unique ways to kind of help address. And so these wins, when you're talking about parity, it's going to be the long game for us to get there, but they are big wins for us. What comes to mind, and Tera and I have been talking about this on the Health Justice Recovery Alliance Committee, is like workforce issues, right? Where are we going to get the people? How are we going to get the people and actually pay them equitably so they will come work for organizations to help address these? And I'm seeing it as an executive director. I think we have probably 15, 20 positions open. We have about 170 FTE within my organization, but talking with other executive directors, we have so many positions open because we can't get people to come into work. And part of that is, how we can't pay folks enough to get them to come into organizations. And so, Tera, do you want to just follow up with that? We've had a lot of discussions, spirited discussions around workforce on the Health Justice Recovery Alliance work groups that we participate in.
Yeah, and I think it goes to what Chris was saying. I mean, I don't want to get too down in the dumps that there's no way of fixing anything. And it's really easy to do. There's so many issues that, you start seeing some hope, and then you're like, well, wait, we don't have anybody who can fill that position. And how are we going to get to the workforce? And these are all issues that we're all facing. From a workforce standpoint, I think, one devastating thing that we're seeing is that there's treatment centers and service centers about to close because of the workforce issues and because of COVID and not being able to fund those at the appropriate levels. And we're already at the bottom of access to services in Oregon. And we just can't afford, in my mind, we can't afford to lose 5, going back to what Chris is saying of we need to build long-term, but we really need to be focused on crisis management as well at the same time. And crisis management is about figuring out, how do we pay people more? How do we make sure that we're creating jobs that we can support them also emotionally, because these are not easy jobs, and there's a high burnout and turnover rate, and really respect the work that a lot of your folks do and our members do, right? Because addiction and substance use and mental health are so overly stigmatized. What's happened is that, it's underfunded and underappreciated. And it's going to take a national conversation, I think, from a workforce perspective, of really putting in the resources and creating the program similar to what we did with nursing to ensure that we can build that workforce. Now, that still doesn't leave us anywhere in Oregon, as we are, as you have, I think there's 400 peers, open peer positions right now in Oregon. And then you see that ballot measure 110 is pouring money into peer run organizations. So with the money, can we still hire folks? And, you know, it's that maybe field of dreams of if you build it, they will come. And how do we do the recruitment and the outreach? And then the separate issue is really linguistically and culturally specific workforce, and building the programs and sustaining those programs where it's worth it to get trained and certified in these spaces, and to make sure that we're really creating spaces that folks want to come into long term and have a long term role and know that they can make this a career. And most of it is, you know, people with lived experience who want to do this almost as service work, and can actually have a really meaningful career. And that's the work that we have to do in figuring out. And as you know, the legislature passed a lot of great workforce bills. Again, they're going to take a long time to implement, and it's going to take a lot of advocacy to make sure that they're implemented well, and they have the intended impact, and they don't just turn into kind of a bureaucratic quagmire that sits and they got to pat themselves on the back and say we did something, and then meanwhile we're all here supposed to be the ones that actually are showing the results. So we've had a lot of conversations about workforce. It's not a thing that we're going to solve in the short term, but it is a thing that I think now finally is front of mind for a lot of people. And I do think that the smartest people are at the table trying to work through that, and they actually have the attention of policymakers and the people who are in charge of our budgets attention.
Yeah.
I do. I feel like the harbinger of doom in this conversation. Every once in a while, I'm more optimistic to this, but I mean, let's think about where our workforce started, particularly when we're talking about peers. Okay, it's an important workforce, but it was also viewed as a way to pay people less. Mm-hmm. So we're going to offshore some of this really hard work to folks, and we're going to do it for as cheaply as possible because it's less expensive than the other people that were paying poorly. And that's the legacy we went into this with. So you're taking a system that was under-resourced and didn't compensate people very well for the credentials they came with, and we're going to put the bulk of the work on the back of people with lived experience so we can pay them less. And that's a poor starting point to go into a pandemic that was going to lead to a labor shortage regardless of the industry. So there does need, I mean, workforce, you know, one of the things that we need to do in crisis management right now is just flood the system with money just to retain the services we have. And we're here talking about homelessness. While this conversation is going on, our children's system has collapsed. So if you have an acute need and you're a child in the state of Oregon, we really do not have a resource for you. Now, you want to prevent future homelessness? How about nipping the problem in the bud when this shows up? And that shows up when you're a kid. Shows up when you're in high school, it shows up when you're in college. And we know if we intervene then with the right services, whether it's a substance use disorder or it's mental illness or it's co-occurring, then we save a lifetime of trauma and hurt and loss, and be able to equip people for the inevitable relapse and the relapse prevention and the recovery from relapse, right? But right now, our children's system, you can't get a residential bed, for example, in our kids' system. You will be boarded in the emergency department if you're not just sent home because we have no place to serve you. And that's a workforce issue. That's a capacity issue. And, you know, and it's only been made worse by the pandemic. And then you layer on top of this, the poor compensation to providers, the poor compensation to peers, the poor compensation to licensed professionals who work in the public system. And you just, again, you have this crisis. You know, I would argue, Tara, we didn't do enough on workforce. Actually, the bills we did on workforce are very, very marginal, right? We're going to forgive your loan. We're going to pay, you know, if you're on the licensure track, you don't have to pay out of pocket for your own supervision. They don't get to compensation. Mm-hmm. And so again, that's where we're going back to the legislature and saying, you've got to flood the money in the system to preserve what we have now. And you do that by, emergency compensation increases, by retention bonuses, and those things that enhance your ability to compete on the labor market. Because the one thing that COVID also has displayed, this is hard work. And if I have a choice, this is probably not work I'm going to do. Definitely not at this compensation level, because life has taken on a different importance for me, and what balance in my life has taken on a different importance for me. So when we're asking people to do the hardest work, we're going to pay them the least amount. That doesn't help preserve what we have, let alone build to a future.
Yeah, I think these are all real issues that we're faced with as leaders of organizations. And I think it's great for folks to hear that we're all thinking about that stuff, and that there's so many other barriers besides the fact that people are houseless. Trying to serve and trying to solve these issues, it seems like everything is against us in trying to do this. But I also feel, with seeing everybody at the different tables in at least the last year and a half, we do have a lot of very invested folks at the table. I feel like we can't get out of this conversation without bringing up the Metro Supportive Housing Services measure, which is another influx of about, I think, 200 million a year within the Tri-County area. And so it'll be interesting to see. I know that each county is coming up with has come up with their own strategic plan in alignment with Metro to figure out how to best serve each individual counties, how to best, solve different types of housing needs, to permanent housing, to maybe short turnaround housing, rapid rehousing, shelters. We know that shelters and short-term housing isn't a long-term solution, right? So how do these two things work? How do permanent housing and short-term housing work together to solve some of these issues? And so I know that waiting for each county's rolling out their own different approach, and some counties are doing better than others. But it'll be interesting to see how this plays out in the long term. It's still a little too soon, from my view, to see anything, to see it come to fruition right now. Chris, do you have any experience or any with the?
Well, I have some. This is just based on private conversations. So, the benefit of being with the organization I am and the role I am is we're kind of a Switzerland of people who want to complain. And we get to hear, I'm fortunate. I get to talk to a lot of people CEOs and people who just normally aren't talking to community-based organizations directly. And so, I have a little bit of hope. I think Washington County is doing some interesting things. I think it's too early to tell what Clackamas County really is going to do. We just have to admit, as advocates, Multnomah County is a mess. It's always been a mess. Between the city of Portland and Multnomah County, I don't think they could unhouse their way out of a paper bag sometimes. And, that's not because there's bad people there. It's just there's a political dynamics and bureaucracy at play that makes it really hard to do things in this area that rapidly in particular. And the one thing that we lost in the pandemic is the luxury of time. That is gone. And so the question then becomes, how do you take bureaucracies and politics and dynamics in the most populous county your rapidity is not what they're known for, and say, not only do you have to do this faster, but you have to do it more effectively than at any time you've done this in the past. And that's going to be a huge, huge challenge. And I think that's, it's not out of the realm of possibility that can happen. But that's a huge open question, and that's that's going to take some real, I think, strong, ardent voices from the advocacy community to say, look, you guys have to do better. This is not, you can't follow your past patterns anymore. And I thought it was really telling that Sharon Myron, who's a Multnomah County commissioner, while not quite saying what I'm saying about the county and city, in an op-ed piece recently in the Oregonian, essentially said kind of that theme is, look, we got to plant a flag now. We can't wait 6 months from now. And so, as I said, I think, as advocates, it's time for us to be extremely impatient, and just be stronger voices and be, frankly, less polite.
Yeah. I think we all have a lot of solution finding to do within our organizations. And I think what you said earlier about we need to flood the system with dollars to keep existing organizations going so we don't lose anything that we have existing right now to put us even further back. One of the challenges that I see as a provider with all this money on the table is, while I appreciate counties wanting to be very strategic in their method of getting the money out, it doesn't really solve the immediate influx of cash that organizations need to keep going. For example, today in finance, we were talking about how to keep a half FTE for administrative support to push to do housing work, right? And so we don't have the money for it. And so we're like, okay, where can we find X amount of dollars to keep this FTE for the next 8 months, or do we need to cut it, right? So when organizations have to make decisions like that, it really impacts the way that we serve and address and help those who are currently houseless in whatever way that they got into their current situation. And so we do have to get an influx of money into organizations to keep current services going while we plan and do more strategic planning to solve some of the issues that we have.
Well, and I think it also changes how we think about strategic planning for the future. We're planning for the future as if there's going to be the past normal coming around at some point. And one thing, maybe the lesson learned here is normal may look vastly different. And are we adjusting our thinking to that? Right. And so, again, I think we've lost the luxury of time. The Metro measure was going to end homelessness. Well, guess what? Homelessness has exploded. So what we thought was going to end homeless may be completely inadequate now. So those are the kind of things that I think we have to, upon our people managing these systems and managing this money, we have to force them to be more nimble in how they even think, not only short term, but how they think strategically long term, because that world may be, that world that we had projected out there once the pandemic ended, it may not be there.
And I think it's important that we also trust our providers on the ground. And that's a lot of what we talk about at our table, is the fact that, we have all these systems in place for control and alleged accountability, but it's not meeting the needs of the folks on the ground. And we have a lot of words to basically say, we don't trust your experience and your lived experience enough to just give you money. So we're going to give it to this large organization and it's going to go through a ton of bureaucracy, or we're going to do it through the county or whatever the mechanism is. And we really do need to be willing to try things, and also be willing to respect and trust our providers, especially our culturally specific providers who know what their communities need. And it may not feel comfortable for some of our bureaucracies, but it doesn't matter. I mean, going back to what Chris is saying, we do have to be loud, we have to be vocal, and we have to be cranky about what's happening, and quite frankly pissed off because people are dying unnecessarily because of the systems that want to keep kind of things going. And we're looking at an eviction moratorium that's coming up that's going to flood our streets even more, and more people are going to be so traumatized that we're going to have a really hard time wrapping our arms around everybody. So it is time to stop, to get some hustle back into government, and to recognize that this is an issue that we don't get to just look at lists and plots of land. These are plots of land. I mean, quite frankly, when I was in the mayor's office, we were looking at the same city properties. So it's about making sure that we're, actually just doing it. And some of it is, doing it and asking for forgiveness. Some of it is just making sure that we're empowering our community-based organizations and saying, you know what, we've messed it up so far. So here's some money and let us know what you need, and we got you. That's kind of the attitude that I think we need to be moving towards, because people are dying and people are being traumatized to a level that I don't think any of us can really internalize and then ever leave the house again.
And just to add on that, Tara, and that's where I think we're in danger, because a whole cohort of people are going to come coming forward with mental health disorders and substance use disorders. We're talking about how this has made problems worse for people already susceptible to that. we've got new people coming forward who would never have experienced these things except for all these things, losing their housing, the accumulation of stress. Remember, the NBA shut down March 11th of 2020. And since that point forward, whether it's the pandemic, an election, an insurrection, wildfires, we have been as a population under unrelenting stress. And that takes its toll. And so, right. So, we're not ready for that. And so there are times you have to just throw money at a problem. You have to accept there are going to be inefficiencies. And this is one of those times.
Mm-hmm.
Absolutely. I think, Tara, that kind of moves us into our other questions, kind of talking about equity. But you brought up, bringing in culturally specific organizations, or more specifically, BIPOC organizations who are serving their own communities, right? And so oftentimes in Bridges to Change has been part of this, is like we're handed the money as a white dominant organization, and then to provide services for BIPOC communities. What I see happening with Measure 110 is a door opening so we can bring BIPOC community service providers to the table and get them the funds that they need, not only for infrastructure for their organizations, for technical support, so folks can serve their own communities, and other communities like mine can come in and support in other ways. And so there's a lot of discussion. I think there's a lot of appetite right now to really help stand up culturally specific organizations. How do you see that playing out in Measure 110? This also relates to mental health and addiction services. We have a lot of great providers that are at our tables giving us feedback on a weekly basis. So you want to share a little bit about that?
Yeah, I mean, it's some of my favorite parts of the day is really hearing what's going on for folks, what the frustrations, what the barriers are. And some of it's so simple that it's devastating that we haven't already fixed some of these systems, which is, not having the operations support, not having the technical support, not having access to that, not being heard when you're saying, I need money or I'm going to close my doors. I've already mortgaged my house. I've already maxed out every credit card to provide services to my community, and I'm at the wall. And so, that was part of why we pushed so hard to get money out the door at the end of last legislative session for these providers, because that's what we kept hearing. We were like, oh, the legislature was saying, we're worried we can't get this money out and it's just going to sit in an account. And we're hearing, I'm going to close my doors. And I'm one of 10 culturally specific providers that are able to do this. And so I think that, one of the things that we're trying to do is be flexible. You need technical assistance. Great. Let's go find it. Let's go get you an accountant. Let's just go find a grant writer and make sure that you can get the grant written, and then we'll figure out how to do grant management. That's the crisis management. It's not long-term stability, but it is let's plug the hole and then move forward. But what we've seen is that we talk a big game on culturally specific providers and how much we care about the community. And then when it comes down to it, a lot of our government isn't being responsive to these providers, and it's coded in you weren't able to come up with the right business license, or you weren't able to come up with this. It's like, well, then stop everything you're doing and go get them the business license. Do we care about these services or not? And do we care about these communities or not? And so we've been putting that, and I'm excited about the Oversight and Accountability Council. It's primarily people with lived experience, and it's primarily people of color who are going to have huge ability to divert these resources to their communities, because they're the ones writing the rules and they're the ones writing the grants and are going to be the ones evaluating the grants. And I think that's a game changer. That hasn't happened, at least that I've seen, especially not with $300 million going into the system and being able to have that kind of perspective. Now, can that shift because people get nervous and they're worried and then they go to the old system? That's where we come along and are there to help support, push, and empower to make sure that it does. We've already broken the system. We have to make sure that we're getting a system that really works for our communities.
Yeah, add to that regardless of the disorder you have, whether it's mental health, addiction, both, the number one predictor of whether or not treatment's going to be successful, that treatment episode, isn't necessarily the acronyms behind somebody's name. It's, do I see myself in you as my clinician or as my peer, right? And so it's contingent on building out that workforce. It's contingent upon building out organizations. It's contingent upon building out organizations that exist, like, Asian Health and Services, for example. Central City Concern has a really good Latino program. Can we build that out? Can you build out the Avel Gorley Center for Healing at OHSU? And at the same time, can you take the Miracles Club and make them more than the Miracles Club, right? Can you professionalize that organization in a manner that they then maybe consider becoming more than just the Miracles Club? They also become more than a community center. They actually become a health center and do these other activities that these other providers do that don't do the social side of things very well. So there's some opportunities here with this new money coming in to really build out, not only current providers, but maybe future providers that really do the social side of those things, or the support group side of those things, the peer side of those things really well. And I think that's the piece I'm most excited about, is taking these organizations that run on very slim to no margins, and can an infusion of money, I don't want to say professionalize them in a sense, because you don't want to do that, but I think the idea is you make them going concerns and going businesses that allow them to do the kind of strategic planning that allow them to expand into other areas where they would probably do better than our current network of providers, because our current network providers don't look like the community that they're serving. And so that's I think a longer term opportunity. Short term, what I worry about is what we've just been talked about is, most of us who are in nonprofit business do it through altruism, and we're willing to max our credit cards and doing those things. And eventually you can't do that anymore. Yeah. So we need to hold on to all these things that we have. And so that's, strategically, let's hold on to what we have and begin as we, systematically building out what we need, so that it is more reflective of the communities that either aren't getting served or vastly underserved and underrepresented.
I think that's where real equity comes into this process of raising up and giving the resources to these community providers that are serving their own most impacted communities. For example, helping an organ. Well, you brought up Miracles, right? Why can't we, or why doesn't the county or the state spend $300,000, $400,000 to help build up their administrative infrastructure, so they have the capacity to really strategic plan out what they do best, right? And so other organizations like mine, or Central City Concern, or Volunteers of America Oregon, CODA, like we don't need $400,000 for administrative, guidance, support, technical assistance. And so the real equity comes in is to giving the organizations what they need, and it's okay that we don't get it, right? And so there's such a competitive process with government funds. It really pigeonholes the ability to be flexible and do more for somebody else that you wouldn't do for another organization. So
yeah. At the same time, though, Monta, right? You guys as an organization can't be, wringing your hands over a half-time FTE either, right? So, and sometimes what we do in government is like, this is the thing du jour, BIPOC, all this stuff. And so we have to guard against, well, we're going to focus on that for 2 years, and then we're going to forget about that. And then we're going to focus on this other shiny object. It's really, are we going to build BIPOC providers or not? And that's a long-term sustained thing. At the same time, maybe your organization doesn't get the same amount of resources, but we also can't have your organization fretting over a half-time position. So really, it takes a nimbleness. It's almost like a venture capital kind of attitude, which is, we've got this pot of money, let's invest it, and let's accept. And I think this is the challenge with anything that's publicly funding. We'll have to accept that some of this will be done inefficiently and imperfectly, but the moment calls for that. And so that's what it takes. It takes a huge investment if we're going to build out BIPOC. It takes maybe a smaller investment, but we can't forget that investment to help these other organizations that are barely getting by on the margins.
And not let any services close in the meantime.
Yeah. I mean, really what you're saying, Chris, it's the same strategic approach of a stimulus packages that were passed in the last 2 years to flood the system to keep a heartbeat in it. And if that works, why can't we do it at the smaller level, which actually is the most expensive cost to this country right now? One of the most expensive costs to this country is like, why can't we flood the system with the dollars? And yeah, there's going to be inefficiencies with how it's spent, and it's not going to be perfect, but it's a lot better than really closing the line of funds to organizations as they slowly close and then go away, right? We can't afford to lose anything right now.
No, and I think this is that area where, stigma really works against us, because of those of us who live with these things, particularly when you're an adult, and somebody spends on you inefficiently, oh man, you think the sky was falling, because it's our own fault if we just pulled ourselves up by our bootstraps, if you would just do this, do that. And so it's going to take, I think, a public payer system that's willing to take a little bit, some abuse around that, but it's the right thing to do.
Well, and then you add being a person of color on top of that, and the attention is even that much more, and the scrutiny is even that much more intense. And it's, and then you throw in addicts, and you don't want to give addicts money that they can't, who knows what we're going to do with it. So,
yeah. Well, I'm really excited the way this conversation went today. It really focused on more systemic issues in terms of funding streams and the way that we approach solving solutions at an organizational level, which is really putting up some of the largest barriers to solve the issues that we have to face as providers out there. So I'm hoping that people find that exciting. For just kind of closing us out, how do you continue today within all the challenges that we have to create hope within the work that you're doing? How do you wake up every day and do the same thing with all the stuff that we have to face? Either of you could go first.
Well, I'll go first. I think, part of it is I've only been doing this work solely for 10 months. So I haven't been having the same conversations as you all have had for years. And I think that that's helpful for just my own mental health and my own ability to wake up and not feel like this is just a problem that we're never going to be able to solve. I also think that, I am really excited about Measure 110. I know that, there's plenty of things that we can pick it apart and have naysayers, but at the end of the day, I'm choosing to assume we're going to get a transformative system and work every day and every step of the way to do that. And if it helps a handful of folks at the beginning, and those are people who wouldn't have had those opportunities, then that's hope. That's what I hold on to.
I think for me, it's I know people are following in my footsteps. My experience in the mental health system was not good, but it was better because of people came before me who were certainly vastly more abused than I ever was, made the system better for me. And I have an obligation to make the system better for others. That's one. And so it's just personal. Two is the being part of a peer-based organization like this, to come in and live with, I had onset in early college. So to come in and to an organization later in life and find people who thought like I did, had experiences like I did, had the same challenges like I did. So you're not alone. Frankly, there's tremendous therapeutic value in working here, despite all the heartache. And so being able to, as a peer-based organization, as a community-based organization, to go out to other individuals, to go out to families, to go out to parents, to go out to youth that are experiencing these things and embrace them, because we know exactly what they're going through. They don't have to explain themselves to us. They don't have to feel ashamed about what they have experienced or will experience. That I wake up with hope because I get to do that. And that helps me as much as I think it helps other people.
Yeah, absolutely. And also as a peer, just coming through the system and kind of climbing out of the different challenges that I had in my life, just seeing a little bit of change in one person kind of keeps me going every day. And although the work ahead of us is hard, every day I just wake up with like, what is my part today? You know, from being a peer mentor when I started in this field, helping men get out of prison and find recovery over 10 years ago, to running an organization, you know, and today I think of it as what is my impact today? And that really keeps me going. And I think, you know, our vision statement at Bridges is creating hope through community. And it's not a house doesn't solve one issue. It's so many people coming to the table, providing some type of wraparound support for our folks. So I want to thank you both for coming today and having this conversation. I'm glad it went the way that it did. So I think folks will find that helpful.
Thanks, Monta.
Yeah.
You're welcome. Thank you for the opportunity.
All right. We'll talk to you later and we'll be in touch.
Bye.
Bye-bye.